Stockouts of personal protective gear at lower health facilities in some low health centers in Western Uganda leaves doctors dying and suffering from COVID-19 as they contract it from the patients they are entrusted to heal. Government has tried to reduce on the transmission of COVID-19, putting in place the necessary measures, but there is one last person who always remains on the option when COVID-19 continues to infect Ugandans, called the health worker.
We have been chosen. We have been chosen by God.
It was in 2019 when the dangerous COVID-19 disease started in China and spread to almost all countries in the world, leaving more than 4.2 million people dead. But in Uganda, it has registered over 95,226 cases, over 88,502 have recovered, and 2,700 have died, among them health workers.
We only find ourselves without masks. Sometimes we use masks and they get finished. So that one leads to getting the infection. So we are requesting the government to supply enough masks, enough gloves to the facilities. Because you find we don't have even gloves at the facility, and yet you have to work on the patients, and they say you have to protect yourself by putting on gloves. And sometimes you find using a pair of gloves on several patients, which is causing cross-infection because of lack of enough gloves at the facility. Yeah. Even sanitizer, you may find when there is no sanitizer, because if there is no glove, at least you can sanitize and work on the next patient.
Previously, we ran out of protective equipment, personal protective equipment, and that's why we contracted the disease, because we were serving the clients. So in the process of serving clients, that's when we got the disease, because we did not have personal protective equipment, so it was easy for us to get the disease.
Alice Ariganyira, a midwife at Kagote Health Center 3, Kabarole District, who just healed from the disease, blames it on the working conditions at the lower health centers, just like Arinda Deo, a dispenser at Bukuku Health Center 4. The district has registered 10 cases of COVID-19 among its workers since the second wave broke out in May this year.
Getting the test, I was feeling some symptoms. I had already some signs and symptoms. They are the ones which forced me to go for a test. But before I had tested, because I had contacts at the facility, and it was negative. By this time, when I developed signs and symptoms, I decided to go for the test. And indeed, it turned to be positive. And when they read out the results, I couldn't refuse, because I had cancelled myself. If I find I'm positive, then I have to go on with the treatment, since I had started on the preventive treatment. So when they tested me positive, I continued taking treatment, but I could see the life going.
Some of our colleagues have gotten COVID-19 along the way. Fortunately, they managed to treat it, and they are now fine. And I'm among the people who have suffered from COVID-19 and treated it. So when it got better, then I came back to work. So we have been having a challenge of personal protective equipment, but recently we got a supply from partners like Baira. They managed to bring us equipment for hand washing materials, face masks, and the face shields. And also we received some from NMS. So currently we are fine. as far as personal protective equipment are concerned.
At Uganda Matters Hospital in Uganda district, the situation seems to be worse after one of its health workers, Justin Chomjisha, died of COVID-19. She died at Mbarara Regional Referral Hospital after failing to get treatment from Uganda. Bernard Muhwezi Kabambuza, a widower, explains the ordeal.
According to her, according to what she told me when she was still speaking, she says she could have contracted the disease from one of the patients she was treating on ward. So when she came home, she never knew, obviously. Within 4 days, the whole family was already infected, and we all went for tests and we were positive.
As I wouldn't even say that she contracted it from the hospital because it's difficult. I mean, we interact. We are not isolated only in the hospital. We move out of the hospital. You wouldn't. It's difficult to know where you contracted COVID from. It's quite difficult, as you know. You cannot see the virus.
Her death did not only torment Bernard, but it is still stigmatizing him in the face of the public, pointing at him to be infected with the virus.
After her death, the whole village had already known that my family was positive. So even asking for something from the shop, I talk from the distance for something. Otherwise, someone even closes their shop fearing that you might infect them with COVID-19, even if you tell them you are healed.
This hospital is the only one in Uganda where treatment is carried out and severe cases are referred to Mbarara Regional Referral Hospital. Emmanuel Biarhanga, a gynecologist at this hospital, explains that health workers have been infected. However, he recommends them not to give up their work.
As I told you, the team, the COVID treatment team we have, are people who have been trained and we're willing. It is very important. You don't force someone to go into the treating these patients. They have to be willing. So we do not have any staff who has given up or has resigned because of he or she doesn't want to treat COVID patients.
Dr. Agaba Francis, the in charge of Bukuku Health Center 4, admits that at least a staff from each department at the facility tested positive, just like Dr. Elias Kumbakumba, a pediatrician and a deputy head of hospitals and University Joint Task Force, a senior lecturer at Mbarara University of Science and Technology, cites the same scenario at Mbarara Regional Referral Hospital.
Yes, we are getting many challenges. One is that we ourselves are at an increased risk. Among the people who first died, by the way, in this wave were pediatricians. We lost a lot of pediatricians because children, when we treat children, we look in their throats. And as we try to do that, they cough into your face. So if they have COVID, you'll get it. For them, it may not be serious, but for you, because you are older than adult, and some of them are even elderly, some of our pediatricians were old, they got sick and died. We lost a number of pediatricians in the year, so it's just in peace.
Even in maternity, my nurses, my midwives, tested positive. Many were there. And actually it is disturbing us very much. You find one midwife works night, day. Even right now I don't have a midwife to cover maternity. So the one who was resting is supposed to come back to cover the day duty, because of the infection among the health workers.
Because as I talk, myself, I contracted COVID. But if you ask around, I'm a person who has rarely will see me without a mask if I'm not eating, and with the sanitizers, you see. But I contracted COVID. So COVID is for every person, and it did not come for animals. So anytime you can contract a medicine. Workers, being at the front line, we are always exposed.
With such situation, the health workers now want the government to do what it takes before they all succumb to COVID-19.
Of course, protective gears is challenge.
Protective gears are very few. we recycle masks for use. If you are given 100 pieces, yet we are about 30 doctors and support staff, they can't take us for a week.
In this very case, in cases of death, to me, government should consider compensating these people very fast, because it is also a form of motivation to other people who are still in the field. Otherwise, people will run away because they are scared of their lives.
Some hospitals have closed. During the first wave of the COVID-19 that hit the country from March last year, the health authorities in the district were forced to close down at Nyachitokori Health Center too, after all the 6 health workers at the facility tested positive for COVID-19. Much as the facility resumed its work, the number of patients who used to come to the facility for the services has drastically reduced.
When 10 doctors got COVID-19, they were isolated, treated and healed. Now the number of incoming patients has reduced at this health center as patients fear doctors to infect them.
However, with the lower health centers facing a challenge with the protective gear, at Fort Portal Regional Referral Hospital, the health workers say the government has been providing them with enough PPE, personal protective equipment, to guard against the deadly pandemic. The facility has already admitted 431 COVID-19 patients cumulatively. 285 people have been discharged since the outbreak, while 98 have died of the disease at the facility. Currently, only 27 patients are admitted at the facility, with the hospital recording 1 death per day.
We have adequate PPE. I can say last 2 weeks back we received a batch from NMS, and also we continue to receive from partners like Baylor and UNICEF.
We have been able to discharge 287 patients from that hospital. But as the cases tend to be reducing, we also realize that the number of deaths have been constant. On average, we are losing 1 person in the treatment unit. So we have a cumulative number of deaths at the treatment unit.
However, all is not lost. As the means to save Ugandans from dying, President Yoweri Museveni employed some measures, including the stay-at-home measure, but this could not silence the enemy as it has reached in every part of the country. Hence, the village health team is meant to monitor the high rate of community transmission who are on home-based care treatment and still make follow-ups on patients as they do home-based treatment.
Our community involvement in fighting against COVID-19 has increased community awareness on how to safeguard themselves, hence reducing the number of infections at community level.
We do voluntary work, visit people in their homes and guide them on how to treat themselves. And where the situation becomes worse, we call the doctors to intervene, though we also need enough protective gears.
With strict adherence to the standard operating procedures, SOPs, and a screening of all patients that come to health facilities, the number of health workers being infected has reduced. The funding source of the work produced here was made possible by One IFRA, Women in News, a social impact reporting initiative. We recognize that the content produced reflects the author's views and not those of funders.
Come on, nurses, to love and serve, we have been chosen.